Hello everyone and welcome to BAYER Pharmacists Congress 2021. My name is Julie Woon and I'm truly honored to be your host for today. And thank you for taking the time to join us here on a Saturday and imparting some of your weekend time with us. I truly hope that you're keeping safe, although I'm sure you very well are, since we're in a room full of healthcare practitioners, pharmacists, doctors. Thank you once again for taking the time to join us here. This Congress aims to share and equip you with some interesting updates on common community diseases and management know-how. Now, before we get to the full swing of things, allow me to walk you through our virtual plaza for those of you who had not had the opportunity to do so. Now, this is the lobby area of our virtual plaza. If you take a look at the top right-hand corner, you see a QR code. Now, scan it with your mobile phones and that would lead you to a very nice virtual photo booth for you to take a picture to commemorate today's event. Please feel free to utilize that at any point throughout today. And right over here, you can see a conference hall. I believe many of you are familiar with it. Let's take a look inside the conference hall. This is where you can see our live event ongoing. And later on during the presentations, please use the full screen mode to maximize your viewing experience. And you can also see there's a chat box at the side. You can also speak to your peers, our fellow delegates, ask any questions that you may like. There's also an ask question icon at the top if you have any questions for our speakers, but we do encourage you to ask questions via Slido. Now I'm going to guide you through how you can use Slido in just a bit. Now let's head back out to the lobby area and move on to the next hall. We have an exhibition hall. Now inside the hall you find 4 different booths booths ranging from Bepanthen, Berocca, Claritin, and Redoxon. Let's take a closer look at the booth. And you find 5 different icons for you to click on. If you want more information about the brand, you can just click on the eye icon, and that will lead you to links to the social media page, as well as contact information if you'd like more details about the brand and the product. Next, you can also download PDF files about the products to have a better understanding on what's on offer. If you want to take a closer look at the posters on each booth, just click on this icon. There you go, very nice big smile over there for you. And we also have various TVCs for you to enjoy as well. And finally, the final icon, should you have any questions at all, if you'd like to find out more about the product offerings, of course you can just click in your questions over here, and don't forget to drop your name card, and our product expert will get back to you as soon as possible. These 5 different icons will be available at all 4 booths. There you go, you can see the various icons. Feel free to explore and experience our exhibition hall at any point in time throughout the day, and even after today's Congress, and for the next 6 days it will be available. Now back to the virtual plaza lobby, we have our next hall, and that's the networking hall. This is as real life as possible, as a real event. Now after today's presentation, you can head on to our networking hall, where we'll have a live discussion with our fellow pharmacies. If you want to share your thoughts, your feedback, you want to ask any questions, this is where you can converse and have a dialogue with all of our viewers right here today. Okay, and this is the networking hall, and our final hall for today would be the gallery. Head on inside, and we'll have the profiles of all of our distinguished speakers who are here with us today. Thank you so much for joining us. I know some of our speakers are from out of town, so thank you so much for taking some time off to really share your thoughts and experiences with us. Okay, now back to the lobby area. If you experience any technical difficulties, we do have a reception counter. Just click on the eye icon, and we have a live help desk to guide you through should you have any questions or queries at all. Okay, and with that, that is our virtual plaza. You have ample time to explore and experience after today's Congress. Let's head on back to the conference hall, and don't forget to click on full screen to enjoy today's viewing pleasure. Now, just to give you a rundown of today's agenda, we're very pleased to have with us in the studio, we have Sok Fan, who is the Managing Director of BAYER Malaysia, who will shed more light on why BAYER is dedicated to continuing its efforts to keep pharmacies armed with the latest information, and more about the theme for today's Congress. We're also very pleased to have our esteemed speakers with us. We have Prof. Dr. Tang Ing Ping, who is a consultant ear, nose and throat surgeon, Dr. Leong Kin Fon, consultant pediatric dermatologist, Mr. Lucas Lim, dietitian and co-founder of Dietitian 90 Consultancy, Dr. Tina Suksmasari, ASEAN Nutritional Medical Lead, BAYER Consumer Health, all of whom have been specially invited to share some relevant updates and to impart their knowledge and advice for your practice in the current times. Now, before we begin, allow me to share with you some very important housekeeping notes for today. Now, as you may already know, today's meeting is for educational purposes only, and we do appreciate and seek your kind cooperation to ensure that no recording or screenshot of today's presentations is undertaken, especially without the consent of the speaker, due to the patient's confidentiality. Should you have any questions at all for our speakers, it will be conducted through Slido. We'll answer as many questions as time would permit. So please make sure you have your mobile phones with you. If you're viewing this on your laptop or on your PC, make sure you have your mobile phones next to you to log into Slido, and you can ask questions throughout the presentations. Now, this event has been accorded with 2 MPS CPD points. We will submit your name manually after the event. Now, I trust that all of you know how to use Slido. Now, for the benefit of those of you who don't, this screen would appear. Every time there's a Q&A or a polling session, a QR code like this would appear. All you have to do is just whip out your mobile phones and just scan the QR code. As simple as that. It will bring you to the Slido page for our polling and questions and Q&A for our speakers to answer in just a bit. All right, I believe we are all set and ready to begin today's Congress. And with that, kicking things off, it gives me great pleasure to welcome on stage the Managing Director of BAYER Malaysia, Ms. Leong Sok Fan.
Thank you, Julie. Hi, everyone. Hello. Good afternoon. It's my pleasure to welcome you to the 2021 BAYER Pharmacists Congress, Series 1, entitled Empowering Self-Care in the New Norm. Now, over the last 12 months, we've heard so much about the impact of the coronavirus and the pandemic and how it has fundamentally changed our lives in many ways. Yeah, but thanks to the wonder of science, we know now there's a host of vaccines in the pipeline, which give us a bit of a hope and ray of hope into imagining the post-pandemic world, the new norm, so that we can go back to our normal lives as much as we can. And with this, we know that the new norm is not easy. Yeah? Adjusting to the new norm requires a lot of change in our behavior, in the way we do things and the way we make decisions. Now, I believe in a post-pandemic world, the self-care or taking care of ourselves with the means of science is very important. It will be more important, much more ever than before. And healthcare professionals like pharmacists like yourselves, who are at the forefront in providing expert scientific insights to our community, and also as the primary touch points to support them to take better care of themselves, will be very important. And today's agenda aim to keep you posted and updated on the new developments in some of the common community disease and health matters. And with this, BAYER is also taking a step forward to solidify our commitment to actually support the development of community pharmacists, as well as advance our self-care agenda. So I hope you find the session fruitful today and productive. And I also like to thank the speakers who are taking their time off today to help us support the program. And with that, I wish you a productive section. Thank you.
Thank you very much, Sok Fan, for setting the tone of today's event. And with that, just before we head on to our first speaker for today, we'd like to conduct a quick polling session. Now, this is where you get to try out Slido for the very first time. Whip out your phones right now. Scan the QR code that you see on your screen. I'm going to give you a few moments to do so. Please whip out your phones, scan the QR code, and it will lead you to our polling page. Okay, I'm just going to ask you two very simple questions. There's no right or wrong answers. I just want to hear your thoughts. I can't see you, I can't hear you, but I definitely can see your response. I can see your comments on chat box as well. All right, are we all ready? Now, should you have any issues at all, please feel free to utilize the chat box. I believe most of you are on Slido. Okay, so question number one, how long do you think it takes a patient to be clinically diagnosed with allergic rhinitis? 1 year, 2 years, 3 years, 5 years? Again, there's no right or wrong answer, but most of you, 100% of you said 1 year. Okay, catching up, 2 years, some said 2 years. Okay, I'm going to give you a few moments to answer. Some say 3 years. Now, this is based on your experiences, yeah? So everybody's answer could be different. We want a rough gauge. How long do you think it takes a patient to be clinically diagnosed for allergic rhinitis? Most of you said 1 year. Okay, and then none of you said 5 years so far? All right, okay, 2 years. Catching up, 3 years. Okay, I think it's time for us to move on to the next polling question. How many patients who consult you suffer with allergic rhinitis? Is it 5 to 10%, 11 to 20%, 21 to 30%, more than 30%? Again, we want to hear your thoughts on this. More than 30%? About half of you said so. More than 30% of your patients suffer with allergic rhinitis. That is very, very interesting to note, followed by 11 to 20%. So that is quite a large portion of your patients. All right, thank you for sharing your thoughts. Now, this gives you truly an idea about the topic we're about to cover right now. Okay, thank you so much for your participation. Let's head back to our first speaker for today. Now, I'm going to bring you back in a little later on to Slido for the Q&A session. Should you have any questions at all, please feel free to utilize Slido and we'll answer the questions right after the presentation. Now, allow me to introduce our first speaker for today, Professor Dr. Tang Ing Ping. He's a professor in University Malaysia Sarawak and practicing as a senior consultant in General Hospital Sarawak. He is the immediate past president of the Malaysian Society of Otorhinolaryngologists, Head and Neck Surgeons 2019 and 2020. He has been actively participating in various fields of research in ORL HNS. He has published numerous articles in local and international journals. And here to share with us his thoughts on managing allergies in the new norm, I present to you Prof. Dr. Tang. Over to you.
Thanks, Julie. Can I have my slide, please? Thanks, BAYER, for inviting me to give this talk, Managing Allergic Rhinitis in the New Norm. So before we start talking about allergic rhinitis here, so we would like to give some very short briefing about allergic rhinitis, cold and flu, and now everyone is talking about COVID-19 here. Of course, the symptoms that presented by different kind of group here will be a lot different, but there's some of them that are quite similarity. So I'm just like very brief going to very briefly telling you roughly that symptoms is. So of course, I will start with allergic rhinitis first. So allergic rhinitis, a lot of times they actually come with 4 main symptoms. That is basically you have runny nose, sneezing, then you have nasal obstructions, nasal itchiness, and then sometimes plus some ocular symptoms like eye itchiness, eye watery, and eye tearing disc. But compared to cold and flu a lot of time is due to the viral infection. So viral infection, the duration wise not really very specific. It can be like from 1 week to 2 weeks time. Commonly, they actually have mild cough. Actually, a lot of time can be a dry cough, can be this productive cough. They don't have shortness of breath. Sneezing, yes, sometimes they will have it. Runny nose is very common among these two. And sore throat, sometimes they might have it. And fever is not very common among cold. But flu, yes, sometimes you might have flu, very low-grade fever. But for COVID, I think because this is still very new virus causing the problem, so a lot of time they will have coughing, dry cough, shortness of breath. If you have shortness of breath, most of the time, which is now in the current situation, if you have that, a lot of time you better go and check this PCR test for COVID. Otherwise, 80% of them usually is asymptomatic. So there's the reasons why I want to bring out this slide just to show you guys, at least you know that anything that in doubt, you better just go for your PCR check-in. So what actually is allergy? We come back to allergic rhinitis here, seeing that today talk about allergic rhinitis here. We get rid of COVID-19. We come back to allergic rhinitis here. So allergic rhinitis basically is the IgE type 1 hypersensitivity. It's due to because of exposed to the allergens, then causing that increased exposed to the mast cell. So mast cell release the histamine and then causing acute effect of all these symptoms like sneezing, runny nose. Then it comes to leg phase here, which is causing the runny nose, become nose block, and all these symptoms coming in after the eosinophil are coming in here. So allergic rhinitis in Asia, so we need to know the prevalence of allergic rhinitis in this part of the world. Asia Pacific, basically 150 million of people basically having allergic rhinitis. It's quite a big amount of that. And allergic rhinitis actually impact the quality of life for the patients because it's disturbed the sleep. And then when you have disturbed the sleep, you have daytime somnolence, you have daytime fatigue, and then you have learning impairment of the cognitive function, decrease work performance, and then come to decrease the long-term productivity. So, how do you diagnose allergic rhinitis? I like to use these area guidelines. Area guideline is basically an allergic rhinitis and its impact on asthma. This is a guideline that I use not exactly 100%, but at least I use this guideline to guide me to treat patients and then to put the patient into the diagnosed group. At least I know that what I should do for that. So very easy. You divide the guideline to the duration and the symptoms here. So duration you divide into intermittent and persistent. So intermittent basically is symptom less than 4 days in a week or 4 consecutive weeks there. Persistent means symptoms more than 4 days in a week or more than 4 weeks, the consecutive weeks there. That is the durations of the symptoms. And how about the severity of the symptoms? If you can sleep well, if you can play well, if you can work well, basically there's mild symptoms. If you can't, basically the sleep disturbance, you have problem with carrying out the daily activities, this work, then you know the symptoms getting worse or can divide into moderate and severe here. Of course, the other way of dividing is basically by seasonal or perennial, depends on the type of the, how frequent the allergy rhinitis, the symptoms that you have here. So how do we use the guideline that I discussed just now come to treating a patients with allergy rhinitis here? So let's say you have symptoms less than 4 days in a week and the symptom is very mild. You don't have any problem with sleeping, doing work and playing around. Then basically you just start with some oral antihistamine. Actually, it's quite good enough for you to treat the symptom. If the symptoms is less than 4 days, but very severe, every time you have the symptom very severe, then you might need to add on with intranasal spray, like mentioned in that chart. The symptom persistent after the patient review 2 to 4 weeks time, then basically you step out that. If improve, or if okay, then continue with that. If not improve, then you basically refer to physicians here. Okay, how about a symptom with mild and persistent? Persistent means the symptom more than 4 days in a week or more than 4 consecutive weeks, but the symptom is mild. Then you also need to start with intranasal spray together with an oral antihistamine here. And the last group is basically, which is come with very bad symptoms. Okay, the symptom is basically severe to moderate to severe, but okay, it comes almost at more than 4 days in a week. Then you have to give them intranasal spray plus the oral antihistamine, like mentioned in this table here. And if the symptom is getting worse, which is not respond well, then you might need to refer to specialist ENT surgeons, okay, to have a look or review the symptoms again and see any other things that you need to look into that. So how is the journey of allergy rhinitis patient? So a lot of time you know that not only one group of the specialists or one group of persons to see this kind of patients here. It can be allergists, it can be ENT, it can be GP, it can be pharmacists who seeing this. So this is a study actually done in Philippines, which is 300 people allergic rhinitis there. They actually go through the questionnaire. They found out a lot of time there's a delay in consultations and diagnosis. So every healthcare personnel play a role which will significantly improve the quicker of the patient being referred to the necessary personnel to see and to treat them nicely here. So I like to share with you, there's a study done in 4 countries here, Malaysia, Philippines, Thailand, as well as Indonesia here. We have the study done basically to assess the primary care management of allergic rhinitis. It's a cross-sectional study in 4 these are ASEAN country here, which is published recently in 2002 December here. So this study basically we surveyed 329 GP and 548 pharmacies here. So conduct from May to November 2019 to see their compliance in terms of the patient's compliance in terms of how they practice in allergic rhinitis here. So basically, this is what we gain from this study here. So we found out 95% of GP actually rely on clinical history to diagnose the symptoms here. And then what treatment option available in primary care, ranging from single antihistamine to combinations of the medications, like I mentioned just now, oral decongestant with antihistamine, as well as non-pharmacological options like saline dosing here. So from that study, we found out that second generation antihistamine is still the mainstay treatment option for allergic rhinitis management, even in doesn't matter in mild or moderate or severe cases here. So you found out second generation of oral antihistamine is still the first choice for the GP as well as the pharmacist to prescribe to patient which is having allergic rhinitis regardless of their severity there. So which one, the second generation antihistamine that I prefer? Basically, it's still loratadine. Loratadine is still preferred among the most GP and the pharmacies based on this study here. So the primary care, their opinion, which is influence patient compliance for allergic rhinitis, you can see from here, basically the three most common reasons that's causing patients apply compliance with the medication is basically length of treatment, route of administrations, efficacy of treatment. We found out that patients like to take the medication via oral, which is oral. That's why oral antihistamine is still the first choice of the patients who have the allergic rhinitis, which is mentioned in this study in 4 ASEAN countries here. So just now, the study also mentioned that area guidelines is well known among GPs. GPs know better about area guideline compared to pharmacies here. And this guideline actually revised now in 2019. You actually can search for it. You can look through that a lot of things that mentions in this guideline, especially treating patients with allergic rhinitis here. And then more than 80% agree that area guideline is very useful in allergic rhinitis management based on the study that performed that I shared just now here. So there's also an electronic study which is done in Philippines here to survey 100 specialists, including the ENT, internal medicines, physicians, and dermatologists here. So we found 100% healthcare personnel consider good safety profile, proven efficacy, and fast relief as important drivers in allergic rhinitis treatment for patients here. And 99% basically consider less drowsy and suitability for all ages are very, very important here. And trusted brand is important among 8 out of 10 healthcare workers saying that here. So from here, basically, we generally can summarize that a trusted brand that provide less drowsy, fast, and long-lasting relief with a good safety profile is the medication which is preferred to choose by the healthcare workers to prescribe to their patients. So despite we have all these international guidelines here, we have area guidelines, but you can see there's still a gap between the guideline and the real world practice. So why I say like this? Because you know the guideline show you, or you should give this, give this. But the guideline not really telling you at what group and what age group that you should give this kind of medication. Which one will you need to choose? Let's say you are giving oral antihistamine. How do you choose the oral antihistamine for the patient? So there's a reason in 2019, there's a few of us, we come out in a guideline in the paper, which is basically described using patient profile to guide the choice of antihistamine in the primary care setting in Malaysia here. So how do we basically do it? We divide to 4 main groups. The first one is basically children and adolescent. Second one is the pregnant lady, pregnant and breastfeeding women. And the third one is working adult. And the last one is basically the elderly, 4 groups there. So how do we, using this patient profile to prescribe medications for them? So we start with the first one, basically is allergic rhinitis in children. So children and adolescents, so you know the prevalence among 6 to 7 years old is around 0.8 to 14.9%. But the older group here, 1.4 to 39.7% of the patients having allergic rhinitis here. So the overall impact of allergic rhinitis is significant, with up to 40% of all young people thought, okay, to be affected actually. And in this group, we actually try not to prescribe them with the older generation of antihistamine. Why? Because basically it had more sedative effect, and then it impaired the sleep and learning, reduce the attention, concentration, and working memory, and also increase the risk of performing the poorer in the test here. So not only that, okay, some of the antihistamine actually have this they have some effect by the juice here. So we had to check, make sure that like patients on fezofenadine, basically make sure that, okay, these patients, if they're taking this antihistamine, they are not taking the grapefruit, because it will affect the concentrations of this antihistamine in their body here. So you have to look into that to see through. So for school children, like I mentioned just now, what are the key notes that that we need to tap back? What are the key notes that we need to make sure that patients actually is safe to use antihistamine? So the first one is try to avoid to use the first generation of antihistamine. Second one, most of the time, you depend on the body weight rather than the age when you prescribe the antihistamine to this group of the patients. Sometimes you can use a topical saline or nasal aspirators as an adjunct therapies to help them. And formulation and taste are very important to make sure the children like the these antihistamine in the taste that they are suitable, they are liking it. And of course, you have to see the food drug interaction just now, I mentioned just now. So if you, let's say, especially the fruit juice, when you're taking some antihistamine, like I mentioned just now, phenolphonidine and bilastine, you have to make sure that you don't serve with the acidic fruit juice, because it will decrease the bioavailability of that medications here. And then lastly is basically, if you feel the symptom is getting worse and not really respond to the medication, better refer to physician, have a look to see what else is going on here. So let's come to the second group, working adult. Working adult, because they need to spend time to concentrate into their work. So to make sure that the medication is non-sedative, safe to use, and of course, daily dosing will be good for them to use here. So because working adult, you need really concentrations to do your work here. So you try not to give them sedating antihistamine. Why? Because it actually reduces down REM sleep. REM sleep is very important for us to have second day awake, second day concentration, second day freshness there. So if you reduce down the REM sleep, which is because of the sedating antihistamine, then you are causing you very drowsy the second day. So this is the reason why we don't advise you to give a patient with a sedating antihistamine, actually the first generation, even though it can so-called like promote drowsiness, promote sleepiness during night time. But basically, the side effect is basically it reduce down the REM sleep, which is not good, okay, for your second day activities there. Then, so working executive, the working adult, like I say, this is basically to show the keratin compared to the placebo. There's a study done. Basically, keratin actually significantly improve in all 7 quality of life domain compared with the placebo here. So driving also very important. So you know that keratin basically is good that to no significant impact on the ability to drive, which is there's a study done here. And the take-home message from this adult, basically you need medication which is avoid the use of sedating or psychomotor impairing antihistamine. And second thing is, if really antihistamine is not good enough, not enough for you to relieve the symptoms, you can add on the decongestant. A long-term use of decongestant is not discouraged because of risk of rebound congestion, especially for the local decongestant. For the oral decongestant, the rebound congestion is not that bad compared to the local decongestant. Of course, if you are doubt with your diagnosis, you always refer to the physician to have a look, is there anything else? Now we come to the third group. The third group of patients, basically, you choose for the pregnant, childbearing age, breastfeeding woman. Basically, you try, like I said just now, non-sedative profile. If let's say for pregnant lady, most of the time we try not to prescribe anything if possible. If really, really can't, then we have to make sure it's safe for pregnancy. At least it's group B medication that you can use it for patients that which is really, really cannot avoid any medications during this period of time. So the key consideration for pregnant or childbearing age breastfeeding woman, basically you try to avoid any medications unless which is really necessary. So from here you can see the category. B basically is a medication which is already tried in animal but not in human being. It's safe in animal but not safe in not the safety in human being. C basically is not safe in animal too. So that's why you can see from the group here, loratadine, levocetirizine, they are basically safe to use in so-called in animals. So if you really, really need it, then you may can use these group B medications for this pregnancy lady. So key notes that take home for message for a woman, basically same thing, non-sedative antihistamine. You try to choose antihistamine that is minimal excrete in breast milk, like loratadine is one of that. Okay, a safety profile, like I mentioned just now, there's a trees in group B, which is you can choose from them. And of course, like I mentioned just now again, if you possible, try not to give any medications in first trimester of pregnancy unless which is really necessary. If any problem, always can refer to specialists to have a look if you have doubt or symptoms persistent or get worse. And the last group of this patient profile that I'd like to discuss here in aging group, in elderly people. So elderly people, you try to give medications which is a single dose because they're already on polypharmacy. That means they're already on multiple medications due to their chronic medical problem like diabetes, hypertension, dyslipidemia. So they are actually on a lot of medications. So you try to make sure that the antihistamine that you give to them is basically a single dosing. Because sometimes they also have problem with dementia. They might not forget what they are taking here. So for this aging group, like I said just now, the medication had to be safe, okay? Especially don't have any cardiac effect, okay, on antihistamine here. So, so this is very, very important when you prescribe to this group of people because all people, they're not only on multiple medications, but you have to make sure that they're actually no problem with the heart, the liver, and also kidney functions. Because let's say they have a problem, you have to adjust the dosage, make sure that they are good enough for the patient to take. Of course, we don't use a sedating antihistamine. We know sedating antihistamine is very bad in elderly patients because it also can reduce, if you're using that, okay, it can increase the risk of accidents like falling down, agitations, all these things. Like I said just now, once daily dose is the most important because they're already on multiple medications. If any problem, always refer to the physician here. So that's the patient profile that I mentioned just now, which is very useful when you choose an antihistamine. Despite whatever that you have for the international guideline, like area guidelines, you can choose this patient profile tools to choose what kind of the antihistamine you can give to the patients. But generally speaking, you try to give non-sedating and non-psychomotor impairment, one daily dosing antihistamine. For children, make sure that there's no interaction with the fruit juice. And of course, for a pregnant lady, try not to give anything unless which is really, really necessary. So like I have mentioned just now, this is an electronic study in Philippines in December 2020. You can see that, okay, in real world healthcare personnel certification survey, most of them are quite like king carotenes, okay, the loratadine medications here. So out of 10 prescribers agree that the brand is convenient to prescribe. 100% of the prescribers agree that the brand provides fast relief of allergic rhinitis symptoms. Almost all prescribers claim that the brand is reliable because it's a very old brand, loratadine. 9 out of 10 prescribers are likely to recommend the brand to their family. This is especially done by this electronic IQVIA study in December 2020. Basically, most of them, 100 of them, are all specialist group here. So this is about carotene. I'd like to introduce something new in my next few slides. Basically, it's a nasal congestion. Symptoms is very most common among the Asia Pacific populations here. So they actually have done a study using Carines. Carines is carotene plus pseudoephedrine here versus the fluticasone on peak nasal inspiratory flow here to see how fast this Carines can release the nasal obstruction based on peak nasal inspiratory flow meters here. So you can see here from this graph here, you can see Carines by the dosing, pre-dosing to 4 hours after dosing, you can see 31.3% increase the peak nasal inspiratory flow compared to others group, the fluticasone nasal spray and the placebo. So you can see based on this peak intake after the first dose, Carine actually improved nasal airflow 2 times more than the fluticasone propionate nasal spray at 1 hour time, which is a significance in p-value here. So this is about Carines. So Carines, you can see, actually provide very quick relief of nasal obstructions in allergic rhinitis patients with bothersome nasal symptom. But of course, you can't use it for long term. If a patient will have a very significant nasal obstruction, if a quick relief, Carines basically is a choice for you to use it. So that is my talk about patients profiling tools, choosing the antihistamine, which is loratadine and Carines. These are the suitable antihistamine that you can use based on whatever that patient profile tool to choose for patient. So with that, I end my talk. Thank you very much.
Thank you very much, Prof. Dr. Tang. And since we have you here, it's time for you to answer some of the questions that our viewers, our fellow pharmacists have. I'm sure you can see on the screen right now. For those of you who'd like to type in your questions, if you've not already done so, just scan the QR code, slido.com. That's where you can type your questions right now. Okay, Prof. Dr. Tang, let's kick off with the first question. As you can see, how long do we consider short-term nasal corticosteroid? Which one preferably to start with?
For these questions, basically, you have to see how long is the symptoms and then what is the symptoms look like. Is it how the severe of the symptoms? Then you know how long you're going to use nasal corticosteroid. It's always a burning questions. We don't really have an answer that, oh, you must on this nasal steroid for 6 months, for 1 year. No, it all depends on the symptoms. Now, what I usually do is I usually will advise my patients, you have to compliance. So we try the medication. It based on the area guidelines, you try for a few months first. Okay, you try for 2-3 months first. Then you see how is the conditions like. Patient really compliant very well, and the symptoms is really can control very well. Then you might start to tapering down the nasal corticosteroid. Some of my patients use it for more than 6 months. Some of them use it for years, but they just use, like some patients use alternate day, but they still use it regularly. So this is about the nasal corticosteroid. There's no something called you have to on this for 6 months or for 1 year, for how many years. No, it all depends on based on the symptoms and based on how good you can control your symptoms, how good compliance using the medication, as well as if you know that you're eligible to any allergens, you can take away the allergens. Then that's great. You might not use any nasal steroid anymore. Now, second part of the question, which one you prefer to start with? There's a few issues that you need to consider about it. Of course, if me, I would like to start, I definitely will start with once a day. Okay, 1-2 puff each nostril once a day. They will be the best medications for use. But of course, sometimes the price, okay, is you need to put into consider, especially in private patients. Sometimes the once a day dose may be quite expensive. Some patients might not afford to get it. So you have to consider like twice a day nasal spray. So all these things you have to put into considerations. And lately, there's another new medications which is add on with antihistamine nasal spray, steroid with the antihistamine in one concentrations. So there's also another choice that you can choose, but because of you need to look at the price and then see can you afford to do that or not.
Okay, thank you very much, Doctor. Now, next question, you talk a little bit about the duration as well, 6 months, a year, and I think this relates to our next question. What is your advice for patients who have concerns over long-term use of allergy medications such as antihistamines or intranasal steroids?
Okay, for these two medications, of course, we don't like advise you to use it for very long. Okay, so antihistamine a lot of time is short-term use here. So what I always do is what I practice is, okay, I will measure that the patients is initial period, the first few weeks, I will really ask them to take it because acute release of the symptoms, sometimes you really need antihistamine. If the nasal congestion is really so bad, you need something quick relief for the symptoms. You can ask them to take with, like I mentioned just now, Carinase antihistamine, which is plus a pseudoephedrine, as long as you don't have any relative contraindications for that medications. So after some times, like 1 or 2 weeks time, when they settle, then you can continue with the nasal steroid spray when the symptoms control. As we know, antihistamine, the action is fast. For the steroid, it takes at least 3 to 7 days, to control the symptoms. So with that two medications, you combine using together for the first a few weeks time, 2 to 3 weeks time. When the symptoms get down, you can slowly tapering down the antihistamine. They continue with the nasal steroid. This is what I always do for the patients with allergic rhinitis. Of course, the patient with the skin lesions, there will be different story. Patients with allergic rhinitis is basically mainly is these two medicate. The antihistamine usually I will use it for a short term. Intranasal spray I will use it for slightly longer period. Depends on the symptoms and how good the patient compliance to the symptoms and as well as the medications.
All right, thank you very much, Prof. Tang. Now, our next question, very interesting as well. Hi, Dr. Tang. Can you become drug tolerant to antihistamines since allergies can trigger every day and you are using the same drug every day? Very relevant question.
Yeah, okay. So drug tolerance, I don't really see much for this kind of patients. A lot of time is antibiotic. Let's say you are looking at the antibiotic because you don't want to have resistance. So antihistamine so far so good. Okay, you don't really have any tolerance, but of course I don't advise you to take it for months and months every day. Once your symptom can control quite well, you try to do it. If you think that you need antihistamine for like few months, that is the time that you need to use a nasal steroid. Like based on area guidelines, if the symptom is more than 4 days, okay, and like I mentioned just now, more than 4 days or more than 4 weeks, okay, even if very mild symptom, you should top up with a nasal steroid, nasal corticosteroid spray to control the symptoms. Otherwise, you can't just on antihistamine for months and months. No, this is not the way of doing it. You need to combine the medications to use it. So I don't see any drug tolerance for antihistamine.
All right, and during this period, of course, we had to have a COVID question as well. People with allergic rhinitis may be allergic to the COVID vaccine, true or false? Your opinion?
Of course it's false, okay? This is not true. Yeah, I have many patients. My patient come and ask me, just like I think yesterday I have clinic. There's basically 10 patients coming in asking me the same question. Can I take vaccines because I have this cancer? Because I think most of my patients, half of them, they actually have cancer in the head and neck region here. So for me, very simple. You can look through all the website, whatever they can tell you. But what I can summarize for you for patients, okay, which is you think that you might not get the vaccine at the moment is a patient which is currently on chemotherapy, okay, chemotherapy and radiotherapy. And second one, if you are pregnant. I think others is just relative contraindications for the vaccine. These two, I would say that you need to really consider if you really want to take vaccine. I repeat again, if you're on chemotherapy, radiotherapy, yes, you might not be suitable candidate. Okay, but sometimes you see, it depends on yourself. You want to do it or not. You have to bear with the consequences. And second one is pregnant. Okay, if you are pregnant, it's not advisable, but it depends on you. I heard some pregnant lady, they also go ahead. But that is a two contraindication for myself. If I really advise patient, I will ask them just to withhold the vaccine. Others, I don't think is really like diabetes, hypertension, blah, blah, blah. I have this cancer, that cancer, which is now in remissions, whatever is that. No, just go ahead with the vaccine. This allergic rhinitis is definitely not an issue for vaccination.
All right, okay, we have one final question. Is it appropriate to change nasal corticosteroid to other corticosteroid? For instance, from budesonide to fluticasone. What do you think? I hope I got that pronounced right.
Yeah, that's right. Budesonide and fluticasone. So basically, why people want to change this medication is a lot of times is the issue of whether the effectiveness of this medication compared to the other one. What I can say here is all depends on, first thing, the patient come back to you when they say that, oh, this medication doesn't really suit me. Then you have to check whether patients using the medication correct way or not. So that the spray, when they use it different, they spray wrongly. Instead of spray towards the nose, okay, to behind the nose, they're going to spray out. There's a lot of things you need to check, okay? There's always there's a pamphlet and a booklet to show you how to spray, whether you spray to the site or to the septum. All these things you have to look into the technique of using it. The second is compliance. You see patient compliance or not. If this really, if you look through at these two matter and almost there's none there, then you have to see what are the other reasons they're asking. If the patient say, I don't like the smell, like I give you an example, there is one medications, the smell is a bit strong compared to the other one. Yeah, this is something you can change it. But in terms of efficacy of the medications, actually like from daily dose to a daily dose medication, I don't think that is really unnecessary. Like let's say for medication, which is because of you need to use twice a day, you have to change to once a day. Yeah, that is advisable. Okay, you can do that. Okay, the patients is that I want something like once a day because I can't get it from this place. Can I get from other place? Yes, that is the one reason you can do that. Like second reasons, because of the smell that you don't like it, you can change it. But just because of you want to change it to something like same daily dosing, in terms of efficacy, not really advisable. So I just want to repeat again, you need to check patient compliance, check the technique before you really decide on to do that.
All right, thank you very much, Prof. Dr. Tang, and that wraps up our Q&A session. Thank you to all of our viewers for your questions, and thank you once again, Prof. Dr. Tang, for providing such insightful data on the real-life allergic rhinitis management from the perspective of pharmacists and specialists. And I'm sure given the multiple antihistamine in the market, we hope that pharmacists would find the patient profiling tool useful in managing patients as well. Thank you very much, Prof. Dr. Tang, once again for joining us away from Sarawak. Do stay on as we've got other exciting presentations right after this as well. Have a great day ahead. Thank you.
Thank you.
All right, now it's time for me to introduce our next speaker for today, Dr. Leong Kin Fon. He's a well-known name in the industry. I'm personally a mom of 2 young children, and many of my mommy friends have heard of him, spoken of him, highly recommended him, consulted him before. He is a consultant pediatric dermatologist in General Hospital Kuala Lumpur. He has contributed a chapter on pigmentary disorder among Asian children in a book called Pediatric Skin of Color, and the main author of a handbook called Atopic Eczema and Psoriasis in Children. He has vast experiences in treating children's skin diseases, and just a gentle reminder to refrain from taking any screenshot or recording of the materials and content that you're about to see due to patient confidentiality. And with that, allow me to welcome Dr. Leong Kin Fon for his presentation. Happy baby, happy mom. Over to you.
Good afternoon, ladies and gentlemen. I'm Dr. Leong here from Kuala Lumpur General Hospital. First of all, I'd like to thank the organizing committee for their kind invitation. Next, I'd like to take the next 25 minutes to go through one of the very common problems among children in the first 2 years of life, which is nappy rash, or another term is diaper rash. My first question here is diaper rash common? And the answer actually is quite obvious. It's not just common, but very common. If you look at different reports in different location or geographical location in this world, they have the range from 4 to 35% that of the baby in the first 2 years of life are affected by nappy rash. This is one of the study in Thailand that recruited 1,000 over children before 4 months old, means younger than 2 years, shown that the prevalence of diaper dermatitis or diaper rash is about 36% of 100. And the rate is significantly reduced over age. And the highest prevalence is in the first 6 months of life. It's not difficult to understand why, because skin is thinner at that time. At the same time, the child may poo and pee more frequent in the first year of life. The next question is, if diaper rash is common in the children in the first 2 years of life, why is it so? And the answer again is pretty obvious, because the baby skin is thinner than adult skin, especially over the diaper area. As a result, the protection against the external stimuli is relatively lesser compared with adult skin or the skin over other parts of the body. And to understand this further, we need to go back and look at the cross-sectional view of our skin. Our skin has 3 layers. The outer layer we call it epidermis, the dermis with collagen, and the fat layer. If today our main title of today's topic is on slimming, then of course I'm going to focus more on the fat layer. If our main the title of our lectures today is on anti-aging and wrinkles, that will focus on the dermal layer. But today is mainly on baby rashes, and most of baby rashes, especially the chronic one or a recurring one, is related to the outer part of our skin, which is epidermis. And for our epidermis have one very important features in which every 4 to 6 weeks, the cells will go through a epidermal cell cycle. Means every 4 to 6 weeks, we have a constant rate to produce another new layer of epidermis. Of course, this nature does not apply to your dermis or the collagen layer. So because of this epidermal cell turnover, you will produce a layer, a strong layer that against the external emission, which is the stratum corneum or the cornea layer, which we call it the emperor dress, because only the intelligent one know the importance of keeping this emperor dress thick enough to prevent the invasion of the external stimuli or infections. Because some ladies, they have a tendency to go for chemical peeling every week or every 2 weeks. By doing too frequent, too regular chemical peeling, this will remove the emperor dress, maybe 80%. As a result, they might easily get irritated by their own cosmetic, well dry air-conditioned room. Even their own sweat might induce itchiness, especially over the area that have undergone frequent chemical peeling. If you look at the thickness, especially the outer part of our skin, the newborn skin is about 60% of the adult skin thickness. As a result, they are more prone to external stimulation and invasions. As mentioned earlier on, the emperor dress play a very important role to lock the water within the skin, at the same time prevent the invasion of the harmful bacteria, irritants, and also allergens into our skin. But over certain area, they are exposed to constant external irritants, be it the pee, the urine, or the poo. We know that poo got enzyme like lipase and proteases, and if the parents or caretaker always use a harsh cleanser with a pH of 8, with anti-99.99, antibacterial, antifungal, antiviral property, all this over time might damage the emperor dress and become thinner. And this will facilitate the water evaporation out to the surrounding, and the skin become dry subsequently. At the same time, it will facilitate the penetration of the fungal, bacterial, and virus, and cause the inflammation even more severe with all these cumulative complications. So this is one example of a young baby initially have irritant contact dermatitis over the nappy area, but since the caregiver failed to remove or put the nappy rash into remission, it evolved further with secondary fungal infection with multiple satellite lesions, means small little dots out from the angulate nappy rash over the nappy area. And the second reason why nappy rash, the rash like to go back recurrent or recur over the nappy area is because in a newborn baby, that usually takes time to adapt to the external stimuli, because in the first 9 months of life, the baby is in a swimming pool. Of course, most of you have forgotten that the first 9 months of your life does not start on your birthday, but start at your formation day, which we call it hari jadi and hari lahir is two different hari. Hari lahir just that you get squeezed out from the mother's body, whereas hari jadi is the fertilization date. So when we look at the babies in utero, our beloved mother have offered us the best environment. The temperature of the body is stable, 36.2 in the morning, 36.8 in the evening. We are protected by a layer of natural moisturizer, we call it vernix caseosa. We are in a water-filled environment with minimal frictions. As a result, the skin are relatively healthy at birth. But once the baby get squeezed out to the external environment, the maternal effect, the skin care from the mother's body slowly taper off over the next 5 to 7 days. And during this time, the baby skin have to handle the pee, the poo, the hot and humid, sweaty weathers, and also the dry, cold, air-conditioned room, and the bacterial cleanser, as well as house dust mite. And all this, if the baby get exposed and have a genetic predisposition to eczema, slowly the skin from relatively normal become dry, scaly, and itchy, then redness, then recurrent over certain hotspot area. So where are the hotspot area in the first 2 years of life? First is the common hotspot for atopic eczema over both sides of the face, outer aspect of the elbows and the shin area. The second group of hotspot is over the neck. Once the child start to have drooling saliva, the saliva with alkaline pH will get sticky over the neck area. And the newborn baby, they have short neck, and with regular frictions, this together with the saliva with high pH, this will cause eczema over the neck area. And the third area, of course, is the nappy area, which is our main focus today. And not difficult to imagine why, because this is the area that get exposed to the enzyme from the fecal, from the stool, from the urine, as well as the area with high humidity, with maceration together with regular friction. If you don't control it early enough, they might end up with secondary fungal, secondary bacterial infections. So all these fluids seems like something benign, harmless, but if you leave it too long over the folded area, they will still end up with skin inflammation. Like cow's milk, they're alkaline in nature, and the pee, you have ammonia, also might irritate the skin, increase the skin pH. Your saliva, the poo, the sweat, all have high content of irritants, enzyme, and might alter the skin pH. Of course, all this over 1 or 2 days, it might not cause any problem, but over every day you have 8 hours in contact with this fluid without proper cleansing, and this will end up with initially dry, scaly, itchy skin. Finally, they become erythema and also weepy eczema with or without fungal and bacterial infections. Next, let us move on to why nappy rash. What is the mathematics behind this looks simple rash over the diaper area? We know nappy rash has a wide spectrum of severity. Initially, in the early stage, they might have transient redness, but will resolve with frequent nappy change with a bit of BAYER cream. But among those that will not manage to stop the progression, they may get progressive, persistent redness, and some in fact get secondary fungal and bacterial infections. So what explains the underlying pathophysiology of this common rash? Is it a very simple mathematics, mean 1 plus 1 equal to 2, or a complex multifactorial? We know now very certain that nappy rash is not due to 1 plus 1 equal to 2, but it's a complex interaction of multiple environmental factors. So what are these environmental factors that contribute to nappy rash? Firstly, one of the most important factors is overhydration or excessive skin moisturization. And this often contributed by the frequent urination, soiling, at the same time well covered up by the diaper area. And not to mention that in tropical country, we have excessive sweating, and together with the friction between the skin to skin and skin with the clothing, and all this will cause skin maceration. Together with inappropriate cleanser, as well as the candida overgrowth, the nappy rash become more and more extensive if you not manage to stop the progression. Without further delay, let us go back to the first most important factors that contribute to nappy rash, which is the overhydration. Beside the frequent urination, not fully trained, not toilet trained, and also in tropical country, excessive sweating over the occlusive area include the nappy area, also will increase the skin moistures. If you have a very excessively moisturized skin and overhydrated, together with friction between skin to skin and skin with the dipoles, and this will contribute to physical maceration of the skin surface. This is one example to demonstrate the skin get macerated by frequent frictions over the overhydrated skin. If you have just appropriately hydrated skin, even though with frequent frictions, it won't end up with maceration. The second important factors is the fecal enzymes. We know that inside our feces, they have lipase, they have proteases and urease. And the urease will convert the urea in the urine into ammonia. At the same time, if inappropriate usage of the cleanser, this all will increase the skin surface pH, and increase in skin surface pH will activate the proteases and lipase system, and this will digest the ceramide, digest the corneal desmosome, end up with skin barrier defect. And this will facilitate the penetration of the irritants, allergens, and water evaporation, end up with nappy area inflammations. And the third important factors is inappropriate alkaline cleanser. Beside the inappropriate alkaline cleanser and ammonia, the diet also might alter the fecal pH. If inappropriate or infrequent clearing of the soil bottoms, this will increase the skin pH, again will activate the proteases and lipase system. The study by Bird et al. Have shown that the wetness and the skin surface pH over the nappy area is higher than the non-nappy area, especially among those that have not achieved toilet train. Once the skin surface pH get alkaline or higher, together with inflammation, this will encourage the colonization and overgrowth of the candida. Of course, not all cases of nappy rash that require antifungal cream, but especially those with persistent, difficult to control nappy rash, especially when those with satellite lesion, means small little pustule or papules at the edges of the original nappy rash area, or the patient have history of frequent oral systemic antibiotics, or when you examine the patient oral cavity, they have evidence of oral thrush. These are the cases that require special attention to eradicate the candida density over this area. Just to recap again, what contribute to the nappy rash? Firstly is increase in skin wetness as well as the skin surface pH. And what contribute to this is the dipoles and the 8 to 10 times of pee and 1 to 4 times of poo, together with the inappropriate alkaline cleanser, candida overgrowth, and all these contribute to the persistent and development of nappy rash. Next, let us move on to management and prevention of nappy rash for both short and long term. Some of the young couples, they define nappy or diaper rash as dipole plus rash. In other words, if there's no dipole, there's no diaper rash. But this is not acceptable in a non-toilet trained babies. Otherwise, the baby might poo or pee many times per day. For example, in terms of numbers of pee per day is about 8 to 12 times in the first few months of life. And based on the diet, the child might have 1 to 4 times of poo every day. So in this case, if you practice diaperless lifestyle or diaperless baby care, you end up with this messy, unhygienic environment, which is practically unacceptable if you live in a condo or in fact in any civilized community nowadays. So today I would like to share with you 8 simple steps in overcome nappy rash, or at least to prevent recalcitrant nappy rash. Firstly, frequent nappy change. It sounds simple, but trust me, it's not simple at all. This every 3 to 4 hours nappy change or immediately after any bowel opening is not easy at all, especially in this modern world. Most of us are very busy, especially at night. You need to wake up middle of the night to do the nappy change. So of course, I do agree that nappy is not diapers, especially nowadays the super absorbent diapers is not cheap at all. Just in case you have a baby boy, one of the way to save the money is by using these creative measures, but be careful if don't strangulate the little bird, otherwise it will cause a lot of injury to the babies. So in terms of the frequency, it's well supported by study that if you do nappy change or diaper change more than 6 times per day, the risk of getting nappy rash is lower compared with those practice less than 6 times per day, especially at night. You have to practice every 4-hourly nappy change, especially if your child has history of nappy rash. So beside the frequency, another important aspect is the type of diapers. Whether you use a super absorbent diapers, which is not environmental friendly, but have a lower risk of getting nappy rash compared with the cloth diapers. And of course, in the rural area, some of them still practice the bare bottom or split pan method. So this is a study conducted in Thailand have shown that if you use a super absorbent diapers, disposable diapers, the risk of nappy rash is lower compared with the cloth diapers. Another simple but practical method is ventilate their groin wherever convenient. So one of the best time is every time after you clean the diaper, the nappy area, and before you apply the next new diapers, if you are free, just keep it open for 5 to 10 minutes to ventilate the groin area, and this is helpful to reduce the skin wetness at the same time the skin pH. The third important skills that you need to learn to handle nappy rash is to clean the area not with harsh cleanser but with just either water or gentle cleanser that's designed for eczema. There are so many brands in the market now are designed for atopic eczema. You can either use it together with water, or other times you just use the water will do. At least twice a day you can use the gentle cleanser. After you have cleaned the area, pat dry, and apply a layer of BAYER cream on top of it. So this is the main function of the BAYER cream. Once you apply on the skin, that prevent the emission of the irritants, allergens from the environment and the setting of nappy rash. We are talking about stool, we are talking about urine, we are talking about harsh cleanser. In Bepanthen, the main skin barrier component is the lanolin. The lanolin inside the Bepanthen has the effect in occlusive effect to prevent the emission of the irritants and allergens. So the Bepanthen ointment prevent recurrent nappy rash by forming an effective lipid barrier, and they contain lanolin. And this lanolin inside this Bepanthen ointment lasts longer than the zinc oxide. And this 10 hours is very important, especially for overnight. If you have a cream only lasts for 3-4 hours, means that you need to wake up again and again to apply over the skin. So beside the lanolin, the Bepanthen have dual action than dexpanthenol. Dexpanthenol will be converted into vitamin B5 incorporated into the coenzyme A, which play an important role in providing energy for skin repair as well as collagen synthesis. And the Bepanthen nappy rash ointment have fulfilled most of the criteria, being a good and safe cream for nappy rash. Firstly, have proven clinical efficacy and safety based on study. At the same time, they maintain ideal moisture level. It's not overhydration. Thirdly, they contain no unnecessary ingredients, no potential sensitizer that induce irritants and allergen contact dermatitis. And one of the very important aspects is pleasant to use, easy to spread over the nappy area and protect the area. And the fifth skills is they also need, being a young couples, a young caregiver, we need to be able to identify early eczema. A lot of young parents, they wait until the area get red, get weepy, then only they start to go for treatment. You should be an experienced couple. They need to identify nappy rash at the early possible stage, in which the area show transient redness during the nappy change. A child that express irritability without any reason, especially after poo and pee, the child cry incessantly. This may suggest the area is stinging, pain, and irritable. And if you notice that, that's the best time for you to do more frequent nappy change, more frequent BAYER cream application. But after a couple of days still continue, then it's time for you to go for some medicated cream, which include low potency steroid, tacrolimus, and pimecrolimus. So being an experienced caregiver, we need to identify nappy rash at this stage, in which there's transient redness, a bit of scaliness. At the same time, the child show irritability of unknown reason, and one of the reason could be the irritable skin over the nappy area. Not all the crying baby is due to colic, and sometimes due to itchiness, due to stinging sensation over the nappy area. But if you have done all I have mentioned just now, yet the redness does not disappear, is unresponsive, it's time for you to get second opinion. And some of the conditions that we need to entertain when they don't improve with the above measure is fungal infection. The clue to fungal infection is when the redness not limited over the convex surface but start to go to the intertriginous, means the flexurous area. At the same time, there are multiple red papules and pustules at the edges of the original nappy rash area. And these are some of the clues to suggest that this area might be infected further or secondarily by candida infections. So consider candida plus nappy rash when they're not responsive to home care more than 5 days, intertriginous and satellite lesion. Of course, at the same time, you need to examine the oral cavity, because the child have oral thrush or candidiasis, also put the child have higher risk of getting nappy or diaper candidiasis. And another risk factor is the child have a few episodes of bacterial infection, was given a few courses of antibiotic. This might alter the GI microbiota and increase, and candida might overgrow over the affected area and start to manifest with nappy or oral candidiasis. The next group of condition that you need to consider when you already properly treated the underlying fungal, yet the eczema nappy rash does not improve. Another group of condition that you need to entertain is allergic contact dermatitis. The allergen might be found in the creams, in the wet wipes, and etc. Wet wipes sounds benign, but this is based on a study by Kelly et al. Analyzed 54 personal hygiene wet wipes. A total of 132 ingredients were identified, and especially some of them under the group of preservative and fragrance, they are potential sensitizer. And one of the notorious one is the MI and MCI, the methyl isothiazolinones. And to identify this, you need to be vigilant to ask about the history of wet wipes. And these are a long list of case report, case series that have proven that wet wipes that contain MI or MCI could be one of the culprit or explanation of poorly controlled nappy rashes. And one of the way to prove it is doing a patch test on your baby, and this on day 5 with the wet wipes or with the active reagent of MCI, MI, shown that there's increase in redness over the patch area. Another reason why the rash does not respond is maybe you have made a wrong diagnosis. So instead of irritant contact dermatitis over the nappy area, it could be psoriasis, could be seborrheic dermatitis, and could be even scabies. So this is a first case that demonstrates that not all rashes over the nappy area is nappy rash due to irritants and allergens. And this is a case that is due to seborrheic dermatitis, the transplacenta sex hormone from the mother to the baby. One of the clues is the morphology of the scales. They are thick, they are yellowish scales. And secondly, the area that affected. They are over the scalp, over the eyebrows, over the axilla, and some cases that in fact go to the groin area. And this is a case of crater cap with buttocks involvement. The second case to demonstrate that not all rashes over nappy area is irritant contact dermatitis over the nappy area. And this is a case of infantile psoriasis supported by the classical color of salmon red, pinkish in color, well-defined border, and also the nail changes of nail pitting as demonstrated here. And the third example that I would like to quote today is not, this is a case with an intense pruritic skin lesions over the nappy area. You see, look at this short video, is intensely pruritic. And when you examine a patient, not to forget to examine other areas that include the palms, the soles, and other family members. And this is a case of scabies infestations. The second last measures that you need to acquire being a young mothers or young couples is need to be even more vigilant if the child already had past history of nappy rash, now the child start to develop diarrhea, you need to do more frequent nappy change, more frequent barrier cream application before the onset of the next episode of nappy rash. This is especially important when you have a loose stool, frequent loose stool, that will cause further irritation to the affected area. And of course, the most effective long-term prevention measures is by potty train your babies. Once your child is toilet trained, then the nappy rash incidence will reduce significantly and drastically. With this, I would like to end my presentation. Ask me any question, and if I don't have time to answer today, then you can send to my email, or you can access my website for further information.
Thank you very much, Dr. Leong. Now, before we begin with the Q&A session, we'd like to conduct a quick polling session. Do scan the QR code as you see on the screen right now. Just one question. Whip out your phones right now. And we have Slido polling session right now. I just want to ask your thoughts on one simple question right after that very insightful and detailed, I must say graphic as well, a presentation. All right, I believe most of you have scanned Slido, and this is all I want to ask you, just one question. Are you now confident in managing baby's nappy rash? 100% of you said yes. Are we all in agreement? Oh, 20% said no, 17, okay, all right. Some are not confident. I believe those who said no, please have your questions ready, also via Slido. But 89% of you, 90% of you say, yes, I'm confident, 92%, 93%, and counting. So majority of you are now more confident in managing baby's nappy rash, which goes to show that Dr. Leong's presentation was indeed very, very in-depth. Dr. Leong, you've done a phenomenal job. All right, thank you so much for all of your participations. All right, thank you very much. Now let's head on to the Q&A session. Can we have Dr. Leong back on the screen, please? Now, for those of you who have not asked your questions, please feel free to type your questions on Slido right now. Hello, Dr. Leong.
Hey, how are you?
Very good, thank you.
Yeah.
Those were very, very interesting topics that you covered earlier on, and very insightful, graphic, and impactful, I must say, with all the images that we just saw. Okay, so Doctor, let us begin with the first question. Hi, Doctor. Okay, the question just changed.
Yeah.
What do you think about the use of organic diapers, since there are a lot of advertisement and claim that their products won't cause nappy rash? What are your thoughts?
First of all, we need to define what is organic. Organic does not mean it's non-allergenic. Organic just means how you harvest, how you plant the ingredients. You can get allergy to any of the organic thing in the jungle. The jungle, all the plants in the jungle are organic. If you go in the jungle, you might get reaction to some of the organic plant that you are touched or in contact with your skin in the jungle. So organic does not mean non-allergenic. You can have organic eggs, organic whatever. You still can have allergy because you're not allergic to the organicity of something, but you are allergic to the protein inside that, or glycoprotein inside that ingredients. So if, let's say, someone claimed that using organic diapers reduce the risk of nappy rash, then I disagree, because organic diapers is not designed to reduce allergic contact, but maybe for other reason, for maybe environmental friendly, all this, I can't argue about those aspects. But basically from nappy rash point of view, it's nothing to do with organic diapers.
All right, thank you for that clarification.
Yeah.
Moving on to the next question. Someone asked, as baby skin is quite sensitive, would you recommend using any topical steroid to manage nappy rash?
Firstly, just now I have shared about 8 steps to handle nappy rash. Steroid and tacrolimus and pimecrolimus are some of the last few medications that I will put on my baby's nappy rash. So most of the time, I will encourage them to do frequent nappy change, to use like Bepanthen and others nappy cream, and make sure that you clean it properly with just water or eczema design cleanser. and you take care of the fungal. If all this does not work, the erythema persists and cause significant irritation to the child. The child cry every time he pulls. Then, of course, you need to use a bit of steroid for 5 to 7 days. If you've decided to use it, you have to use the lower strength, means hydrocortisone for 5 to 7 days, and it's still not improved, then you might need to go for the non-steroidal like tacrolimus and pimecrolimus to control the inflammation.
All right, fantastic. Now, moving on to the next question. What do you think about the practice of putting talcum powder on the diapers during nappy change?
The concept of using the talcum powder is to absorb the extra water, so to keep the area not overhydrated. Just like one of the factors that in fact, the video I showed that if you overhydrate your skin, of course, we know very well that in this world, anything in excess is no good. It's more over moistures your skin, means extra water in your skin also is not very good for a healthy skin. But once you have a overhydrated skin with friction, they end up with maceration. That's the reason why a lot of lorry driver, taxi driver, if they are obese, they always stay in the car. The groin area tends to have maceration and fungal infections. So coming back to the concept of putting powder over those areas to absorb the extra moistures and prevent the overhydration and also maceration. But the negative side of using this is that it might become a medium for certain bacteria and fungus. Secondly, of course, there's a study show that inhalation may cause pneumonia. So these are against the side that against the talcum powder. So all this depends on which side you want to go for. But generally, you can take care of the diaper area without the talcum powder. But if let's say this is their cultural practice, then make sure that you just put a little bit and not like putting like a pepper over the groin area and get the talcum powder vapor out in the environment and get inhaled into the lung. Yeah, those are some of the points that you need to take into consideration.
Okay, so just gently pour on your hand and a little pat will do.
Yeah.
Not a mountain of salt, so to speak. Okay, thank you very much, Dr. Leong. Okay, moving on to our final two questions. Can we use bepanthen ointment on regular daily basis as prevention for nappy rash and other sensitive areas such as neck and behind the knee part?
Yeah, of course, we can use it because it's a barrier cream. The only thing that you need to be careful is an ointment base. So sometimes over certain area, they may cause occlusion and sweating may exacerbate the existing eczema. But over the nappy area, definitely is very helpful because this area that using the lanolin inside the bepanthen ointment will form a occlusive layer to prevent the external emission of the irritants and allergens from the environment. So I encourage that if you have your baby have past history of nappy rash, then you should apply every time after any nappy change. If let's say the nappy area always healthy, then you probably just need to apply twice a day over the nappy area.
I see. I believe this relates to our next question as well. How often should we use a barrier cream? Any indicator to increase or reduce the frequency of application? Would you like to take that?
If, let's say during the time that the child having frequent bowel opening or during teething or during diarrhea, of course, you need to use more frequent. Or those already have past history of nappy rash. In the first 3 months after a single episode of nappy rash, you need to be more careful because even though when the redness disappears, does not mean the skin back to normal immediately. It takes time for the skin to slowly recover. So even though after the first bout of nappy rash attack, you still have to take care of the nappy area for at least another 6 weeks to 2 months. And during these 2 months, you need to make sure there's no longer having a recurrent of nappy rash. If you have every 2 weeks have a recurrent or relapse of nappy rash, means that skin have no time to recover at all. So you need to apply more during episodes of diarrhea. when the child have frequent teething, frequent bowel opening, or after an episode of nappy rash, then you need to be more apply the barrier cream more frequent to protect the area.
All right. Thank you very much, Dr. Leong, for imparting truly your expertise and useful insights, very detailed information on nappy rash management, which is highly common among babies. And truly, as a mom myself, I must say, happy baby, happy mom indeed. And we learned truly a lot from your presentation. Based on the polls earlier on, I believe 95% of our viewers have voted yes. They are more confident now after listening to your presentation. So thank you very much, Dr. Leong.
Thank you.
Have a great day ahead.
Bye.
All right, fantastic. Before we head on to our final topic for today, we're going to head on to the polls, our final polling for today. I'm sure by now you're very familiar with Slido. Scan the QR code as you see on the screen. Each time you see the QR code, just whip out your phones, scan it even before I ask, and it'll lead you to the polling page. I just want to know two questions. I want to hear your thoughts. There's no right or wrong answer, just two very simple questions. I'm going to give you a hint leading up to Ramadan. Let's take a look at the screens right now. If you're logged into Slido, this will be the question that you would see. What's your favorite Ramadan food? Now, it's not a ABC kind of question. Type in your answer. Somebody said layer cake. I absolutely agree with you. Last night I was hunting for layer cake, but it was a bit too late. Kari ayam, murtabak, chicken rendang, fried chicken, satay, kari ayam. A lot of people say satay. Of course, we're Malaysians. Oh, this is making me hungry. I hope all of you have eaten your lunch already. Otherwise, this is going to make you really hungry. A lot say murtabak. How about we have it all? We have kurma murtabak satay for lunch right after this. All right, fantastic. Okay. All right, we know Malaysians, we love our food. Now, our next question is, do you think supplementation is as important during the month of Ramadan? Yes or no? Okay, all of you say yes. Anybody thinks no? No, so far? Everybody said yes. 100% of you said yes. Well, that just goes to show our next topic will be highly relevant and effective since we're all on the same page over here. Oh, a few of you mentioned no. Okay, this is anonymous, so we can't see who answered what. Just key in your answer. Or some of you said no, supplementation is not important, but majority of you said yes, especially during the month of Ramadan. Well, we're going to discuss this in more in-depth for our final presentation. Thank you to all of you for participating in the polling session. Now, here comes our final topic for today, where we cover supplementation in the new norm. For this final topic, we have two speakers joining us here today. First up, we have Mr. Lucas Lim, who is a co-founder and dietitian of Dietitian 90 Consultancy. He's also a certified diabetes educator, accredited by the International Diabetes Federation, as well as SCOPE certified dietitian, accredited by the World Obesity Federation. He believes that a sustainable and healthy diet can create positive changes in human health and the environment. I absolutely agree with that as well. And joining him is Dr. Tina, who is the ASEAN Nutritional Medical Lead for BAYER Consumer Health. She's also the Country Medical Lead for BAYER Consumer Health Indonesia since 2013. Dr. Tina has spoken in numerous public events such as Indonesia Doctors Association, Indonesia Pharmacists Association, and Indonesia Midwives Association. And with that, here to share with us more about supplementation in the new norm, I present to you Mr. Lucas Lim and Dr. Tina. Over to you.
Hi, good day everyone. My name is Lucas and I'm a dietitian here. And I would like to thank BAYER for giving me this opportunity to share my knowledge and information regarding nutrition and diet for this coming Ramadan. Hi, Dr. Tina, nice to meet you here.
Hi, Lucas. Nice to meet you. Hi, everyone. I'm Tina, and I'm actually the BAYER medical person. I'm going to be accompanying Lucas today on our chit-chat on Ramadan and nutrition.
Yes, actually, I feel very honored and very happy to do this sharing session with Dr. Tina here. So, Dr. Tina, let us begin now. So, slides, please.
Okay.
Yeah. So, hi everyone. Yeah, so today we'll be sharing about supplementation in the new norm. So are we really ready for Ramadan? Yeah, so this is the time. So as we all know that the blessed month in this Islamic calendar, which is known as this Ramadan, is here again. Wow, the year passed very fast, 1 year and 1 year. I still remember that last year in Malaysia, we are still facing movement control order. So very sad to say that a lot of like Bazaar Ramadan, they miss it. So how about Dr. Tina, your side during last year Ramadan? How was it?
I think it's the same, Lucas. I mean, it's very limited. We even have curfew. We have curfew. We're not allowed to, I'm a Muslim myself, right? So we're not allowed to pray in the mosque. And you all, some of you know that praying in the mosque during Ramadan is very important for us Muslim, but we're not allowed to do that. We're only allowed to do it at home. We're not even allowed to do it, say, with our family. There's not allowed, people movement is very limited, and people congregation is also very limited, less than 5 people only. So
Yeah.
very, very stressful.
Yeah. So actually, for my side, actually I enjoy Bazaar Ramadan a lot because last time I followed a lot of my Malay friends, yeah, to Bazaar Ramadan. I love all the foods over there. So last year when I heard of it's movement control order, they can't sell this Ramadan. I feel it's a bit missed out. Yeah. So actually, ever since this COVID-19, everyone is practicing the new normal, right? Tina?
Correct. Yeah, yeah, that's true. And talking about Bazaar Ramadan, right? That is also something that me as a mother miss very much, because it actually really lessen the burden for us to cook with, right? Because you experience it yourself, how the bazaar, they have lots of food readily available and ready to eat, and it's home cooked meal, right? So I've missed that as well.
Yes, I believe because even now this year, even though they have no more movement control order, and we are very happy to say that yes, Bazaar Ramadan is dibenarkan. Yes, it's allowed in Malaysia now. But yeah, but now this year we also need to practice the new normal. Yeah.
Yes.
So before this, let's discuss about what is a new normal. This term is about. So actually, from my side, actually, new normal is the new way of living and going about our life, work, and interaction with people. Yeah. So we could really see like in new normal, right? Last time, like my parents, they don't really like a food delivery. But I believe that ever since this pandemic, everyone is now get used to food delivery and e-commerce sort of thing, right, Dr. Tina?
Yeah, correct. I mean, people who don't really like to, or don't trust all that food delivery. I mean, that's our lifeline basically, because of that limited movement control, right?
Yes. So, Dr. Tina, I would like to take this opportunity. I would like to understand more about the challenges faced by Muslim,
Okay.
during this new normal period of time. Could you
Okay.
share first?
Yeah, so maybe before I go into the challenges, perhaps I can just remind our audience a little bit about what Ramadan is. So Ramadan is actually a common tradition it's a ritual for Muslims, right, to fast, right, from early morning, so prior to sunrise until sunset, and it usually goes on for about 30 days, right? So, and the timing every year shifts a little bit, but the length is always 30 days. Now there's a part of Ramadan that's called sahur, which it's an essential part of Ramadan, because it is where you prepare yourself. So it's the first meal of the day. So that is very important, right? But it's also very stressful, Lucas, for us mom, right? I told you before, I'm a Muslim and I'm also a mom. So Ramadan is stressful for me, right? Because this is when mom are expected to perform, say, like provide for the family in terms of preparing the food, right? And you imagine very early, so the sahur usually ends at around 4:30 a.m. That means if we want to cook, we have to wake up at 3 a.m. and sometimes 3:30 a.m. right? It's very stressful, really, for us just to make sure that our family has that. And I think I'm not the only one who's very stressful in terms of facing this Ramadan. I mean, prior to the pandemic, it's already a time that's stressful, but now on top of that we have the pandemic. It is actually felt this stressful thing. I thought I was the only one, right, who experienced it. It turns out that it is validated by a survey that we did last year, right, among Muslim moms. Like the efforts needed during Ramadan, right, we staying healthy and making sure that for the family is provided with good nutrition. It's actually 92% of Muslim mom feels that way. So it's a lot of a lot of pressure for us. It's actually a lot more pressure in comparison to performance at work. Only 60% feels that work is important, but 92% of Muslim moms actually feel this, staying healthy during Ramadan. It's a huge effort that we have to take and make sure that it happens every year. So yeah, like for myself, right, especially now because we work from home, we don't really have that much time. I told you that I have to wake up at 3:30 or 3 a.m. Sometimes I don't have time. And you know what I did, Lucas? I referred to instant food. Instant noodle is my savior because it's filling, right, and the size is just right. But I know it's not nutritious enough, and I know for a fact that it's not nutritious enough. And I know that it's not. I will not be able to give my family instant noodle every day, right? So now, yeah, I need your expertise here. What can I do?
Okay, so Dr. Tina, thanks for your. I really feel you as a mother. See, that's why the greatest being actually is as a mother. You see, like during Ramadan, a lot of like give up of the job, put aside, then family is the main priority. And I heard that you are saying like during Ramadan, all we want because of the stress out, all we want to opt for is convenience. Like last time,
Correct.
we have bazaar. Yeah, you can ask your children or husband to go tapao, to go buy some.
Yeah. I mean, like I can just like take what do you want. I can cater for each of their needs. Like, what do you want? But now, no choice.
No choice.
But-
Yeah, you need to cook. I think they face a lot of stress on is they need to think of the meal, the menu for 3 times a day.
Mm.
So Dr. Tina, you asked the right person. Actually, we dietitian here actually will give you a solution. Like you're asking me like whether like packaging food or whether like we say instant noodle, is it okay or not? Yeah, actually for me, it's not. It's just to say in general, for sure, we want to avoid instant noodles and all this. But in 30
Yes.
days, I believe that some of the days that we can have, like we saw, a cheat day.
Yeah.
Today, I will share some tips with you, Dr. Tina, okay, that how to make it a convenience pack or this instant noodle to make it become a healthier version. Yeah, to help your family members to stay nourished and stay healthy throughout this Ramadan. But before this, I would like to share some study with every one of you here that actually during the Ramadan, right, like what you say, Dr. Tina, a lot of mom, they feel like stressed. So end up they will opt for a convenience food, like we said, instant noodle. So a lot of time when they opt for this, all the convenience food, actually in this convenient food, all we get is just calorie, fat, and carbohydrate, just to make us feel happy on the taste bud, to feel it in our stomach.
Yeah, but as a mother, right, I feel very guilty because I know it's not nutritious enough.
Yeah. So don't worry, Dr. Tina. Today onwards, if you get some tips with it, you can practice it instantly and your family will thank you for it. Yeah. So actually, for the micronutrients that what we see here is they will lack of vitamin C, vitamin D, and zinc. Okay, in the diet. And actually, this vitamin C, D, zinc, actually what we call as an immune booster. It's an immune booster nutrients. So actually, like during Ramadan, like if a lot of time like Ramadan, we will have a lot of like this rice and lack of veggie and lack of fruits. Then it also can contribute to the lack of vitamin D, zinc. Okay, and must not forget if we lack of vitamin D, zinc, and C, they also will face the problem of vitamin B. So Dr. Tina, like, yeah. So during this fasting period, a lot of people for sure. I heard my Muslim friend they thought, oh, it will be a bit lethargic, a bit fatigue, right?
Yes. And
Yeah.
I believe, Lucas, I think that's also because of the choice of food that we consume first time, right? Because, yeah, like I noticed as well, there are certain foods that I consume when doing sahur. If it's not the correct one, wow, I cannot stay fast. I mean, it's very hard for me to stay focused the whole day.
Yes,
Mm.
that's the reason. So I believe besides C, D, and zinc, how to keep you energetic and focused throughout the day is vitamin B. Yeah. So just share with you what are the food that rich in vitamin B. So actually, vitamin B complex, I would say actually vitamin B complex is easily available in all the food we eat, except for processed food. Yeah, because processed food during the process, they already remove parts of the food that some of the important or essential nutrients they has already removed it. And vitamin B play a very important role to keep our metabolism going on, to keep us appetite good, as well as to keep us energetic. So, like for example, like Dr. Tina, you told us that during that they go opt for convenient food, they opt for instant noodle. Actually, don't worry. So, how to add vitamin B complex into how to make our instant noodle into a nutrient dense noodle. So you as a mother, you won't feel so guilty. So, dear pharmacists, actually, this is to share with everyone. Like you have a customer, okay, have a complaint of this. Actually, you can suggest them they can add like meat, fish, or egg into their instant noodle rather than just an empty noodle. And maybe you could like cabbage. Yeah, Dr. Tina, you can add like cabbage, sawi, okay, all this food into the pot of instant noodle. So you see, if you have an instant noodle, you have an egg and you have a vegetable, don't you sound it wholesome? And you will get
Yeah.
nutrients
More colorful as well, right?
yes, and more appetizing.
Yeah.
So actually, another one, how to boost up our vitamin B complex is actually from the dairy. So maybe I would advise that, like you said, like sahur or iftar. Maybe sahur, to make it more the meal more complete. Actually, I'll recommend them to add 1 cup of dairy milk during your sahur. Yes, to make it complete. Actually, at least you have this vitamin B complex from the milk, so you can be energized throughout the day. Okay.
Thank you for the tips.
Yeah, most welcome. So actually, besides vitamin B complex, what else? So besides being energetic, for most important as our concern is we want to keep our family from falling sick. As we all know that now, pandemic, COVID-19, a lot of people is looking for immune booster. Am I right?
Yes,
Yeah.
that's correct. That's correct. I think that's also one of my worry, right? If I don't give my family the correct type of food or the correct nutrition, right? It's just to fill their stomach, but there's no immunity, there's no protection.
So actually, to share tips with every one of you here, so maybe can advise your customer to add on vitamin C and zinc to their diet. This is one of the way to boost up their immune system. So actually, Dr. Tina, I would like to ask from your side that actually, what are the vitamin food that you are consumed to make sure that you stay healthy and not easily to fall sick? What are the vitamin C food that you are consuming?
They just provide fruits, right? Because that's the easiest. Again, like oranges, kiwi, things like that. And my family loves fruit, so and I don't really cook because I know from what I know, if you cook it too much, right, you all the vitamins and minerals diminish, right?
Yes.
So, but that's the type of food that is popular during Ramadan is the food that you cook for hours, right? So that's why I tend to just give my family milk, like you said previously, and fruits.
Fruits. Yes,
Yes.
that's very good. And I heard that like during that before breaking the fast, actually you're like consuming this what we call kurma.
Yes, that's correct.
Yes,
That's correct.
actually
Yep.
kurma is also what we call a good source of vitamin D complex.
Ah,
Vitamin D as well. Yes. So actually good like taking kurma actually is one of the way to keep us to boost energy. Yeah. To keep us feel energetic because it's rich in vitamin B complex as well as fiber. So actually when we talk about vitamin C, like Dr. Tina, you are right. So actually we know that vitamin C is from fruits and vegetables, but a lot of people are consuming a lot of fruits and vegetables, yet they are still falling sick because of the preparation method. Because I usually will tell my client, my customer is that vitamin C actually we know it as very fragile vitamin that they will easily lost through washing and preparation from cooking. because it can be easily destroyed by heat, it can easily flow away with the water, because vitamin C is what we call a vitamin soluble vitamins, water soluble vitamins. So actually, one of the tips I will share with you, how to optimize the intake of vitamin C, actually you can suggest your Muslim customer to add ulam in their diet. Yeah,
It's a very good tip. Oh, I didn't know that. Okay.
Yeah, actually, because when we talk about ulam, it is what we call it's called what we call a Muslim salad lah. Yeah.
Yeah.
Western we call it salad, but in Malay we call it as ulam. Actually, ulam is what we call it's very fresh, and you can instantly take it after you wash it. Okay, then you don't soak it now. You just wash it with running water so that you can preserve the vitamin C. Then you can consume it with it. This is the good way to have the maximum amount of vitamin C to it. And second, yeah, so actually I would suggest sometimes it's not every day. So maybe some of the day. Like my favorite, from ulam side, which one is my favorite is kacang bottle. That's my kacang bottle with sambal. Oh.
Okay. Thanks for the tip. Yeah, I will try that.
Yeah, so besides ulam that we know is by fruits. Okay, actually all the fruits are equally high in vitamin C. So everyone know to boost up immune system, we talk about vitamin C, but not to forget this zinc, our new friend that I would like to introduce to all the pharmacists here today. Zinc is also one of the minerals that help us to boost our immune system. So Dr. Tina, I would like to ask, among the food, zinc food here, which one during Ramadan you would take it?
I think most probably would be just seafood, right? And then the dairy, right?
Dairy.
Yeah, I mean, I've never tried lentils and beans before. This is new for me. So maybe I could just maybe as a variety for next Ramadan I can add that. Yeah.
Yes, this coming Ramadan, this new normal, actually you can practice this at home. Actually, one of the rich zinc food among all, besides seafood, okay, another one is soy. So actually recommend a new dish to everyone, actually tempeh. Everyone actually can enjoy tempeh at home, like tofu,
Yes.
or soybean milk is also very rich in zinc. Yeah.
Okay.
Yeah, so
Alright.
this is a new dish you can prepare. Yeah, besides just seafood and dairy, actually you can prepare on the table. Yeah, a new dish you can let your family to try. Then actually poultry and egg is also good source of zinc-rich food. Like you are practicing, that is very good. Like cheese, yogurt, and what we say, milk is also very good. Yeah, but lentils, seeds, and nuts, maybe this one, you can have it like after iftar. Okay, then at night before bed, actually you can consume like seeds and nuts. Okay, before going to bed.
Okay. I like this tempeh suggestion from you, Lucas, because here in Indonesia, in Jakarta, in my kampung, so to say, tempeh is readily available everywhere and it's quite cheap. So good to know that it's actually rich in vitamins. Okay.
Yes. Yeah, so hopefully these few tips can help you to have a more variety at home and to keep your family safe and healthy. This is the most important one. So actually, Miss Dr. Tina, I just want to ask, actually, what would you like to share with all the pharmacists here about the care tips, okay, to their consumer? So besides we are talking about diet, actually besides diet part, I feel that there's also other aspect, okay, to keep them mentally, socially healthy. Actually, what are the other good care tips for their customer?
Okay, so for our pharmacist friends here, maybe these tips you can share with your consumers. So, especially those who are practicing Ramadan, right? Being content and grateful. I mean, Ramadan is a very special event for Muslims, right? And I think they should try to enjoy it as much as possible. And enjoying it is by being grateful and show gratitude that they're able to enjoy it, because this is an event that only occurs once a year. Second would be time management, right? Hearing what Lucas said, share in previously, maybe we can practice. They can, can suggest for your consumer to practice. I don't know, preparing new foods perhaps, and pre-package and prepared everything first, so not too stressed out, right? And then also, the last one is providing good nutrition for the whole family. And I do realize that sometimes I myself experiencing, right, we can't really get the food that we wanted to give them. So what I usually do would be I refer to supplements, because I know, in the days that I'm just giving them instant noodles with, I know very little nutrition, I refer to supplements, because I know that by that I have them covered. So if I cannot cover them with the good nutrition, to provide them with the food, then at least there's a supplement that would help to complement what I've already give them. So yeah, and then this is actually also one of the things to make sure that all the nutritions, the vitamins and minerals that we need is covered. Correct, right, Lucas?
Yes, I agree with you, Dr. Tina, because a lot of time, like during my practice, maybe sometimes dietitian, a lot of people will say like, oh, focus on diet. But from my practice, I will focus on supplementation as well. Because I know that some, like for example, Dr. Tina, you are working and you are a mother as well. So sometimes due to time, we can't juggle both. But at the same
Correct.
we want
Yes.
to stay healthy. Like for example, sometimes and when I'm busy, I also can't get enough, like what we say, the fruits and vegetables. So actually, what is my another option? Okay, another one is actually a supplementation. Yeah. So actually, just to share with every one of you here, a lot of people, like what we say, like the challenges were faced by the consumer on supplementation. So actually, just to share with all the pharmacists here about the publication with by me and from the pharmacists as well, together we've discussed and come to this publication to share with everyone that actually what are the consumer face on this supplementation. Because a lot of a lot of my clients, they told me that, hey, they don't take supplementation, is from the diet plan or not. So actually, from my point of view, I noticed that they don't want to take supplement. It's not because of other things, but the most important thing is the lack of knowledge. They didn't know that actually, if you select appropriate and a suitable supplement, actually it will provide can optimize your health. So second actually is lack of credible information, because I know that sometimes if they heard outside, they say, oh, taking this supplementation, taking that, sometimes it's overdose on them. If they get the information not from those healthcare professionals. So actually lack of credible information caused them to propagate the misconception. That's why when they heard about supplement, they also will hold their horses. So second is actually third is lack of motivation to comply. You know, a lot of my clients comply on food, diet, and medication. Actually, it's also a challenges for all the pharmacies, right? Sometimes, like some of my clients, they are diabetic, they have hypertension. Sometimes they also not compelling well to the medication intake. So actually, supplementation. Another one is I notice is lack of motivation. Cause them like today they take it, tomorrow they don't take it. This is the problem that they will face. Another one is actually to understand the requirement. So just to share with everyone that how to overcome these challenges. Okay, so dear pharmacists, this is the way, this is the care guide that I will share with everyone. Remember this care, C-A-R-E. C is for categorize. So actually, for example, if a customer of you, okay, a customer of you feel like, oh, it's keep complaining lethargic, so it's categorized under energy deficiency or okay. So if they are energy deficiency, so next we need to go for assessment. Without a proper assessment, we can't give a good recommendation, right, Dr. Tina? Yeah. So
Correct.
assessment is very important. We need to understand actually what is the cause of them being so lethargic all the way, being so tired all the day. Is it from the food itself, or is it from the work, or not enough vitamin B complex intake? Yeah, we need to do appropriate assessment. So from the assessment, actually we know, then actually the pharmacist can give appropriate recommendation to the clients. To give a proper recommendation to them, like taking, oh, since you're busy and like your mother and you're busy, you can't really prepare a wholesome meal. Maybe you need a supplement to have a good foundation. So actually, besides recommending, I feel the most important one is empowerment. Right, Dr. Tina? Because like you recommend your client will okay just follow, but you didn't give a good empowerment. Actually, for halfway they will go away. Yeah. So empowerment, how do we like empower? For example, if you recommend them a big complex supplements, you need to empower them, educate them the importance of continue taking it, and give them a hope of how this can address their problem. And the most importantly, actually, if possible, you can also refer it to a dietitian. So I will take this opportunity to also share with everyone that actually this care guide, when empowerment, actually that pharmacy can partnership with dietitian to enhance to empower our client in optimize and facilitate them to get a good nutrition supplement consultation. Yeah. So this is like what we want to have this care guide to share with everyone. Hopefully this care guide can be a very transparent and very simple yet a very convenient to facilitate our community's pharmacists here to make the right recommendation to our client for their to optimize their health.
Thank you for sharing that, Lucas. So I think if any of our fellow pharmacists here wants to know more about immunity in Ramadan, you can head off to the redoxon booth, right? And then there are a lot of information that you can find there about Ramadan, and then also about immunity. And I think same thing for energy, right, Lucas? For
Yes.
yeah.
So for those who wish to know more about to be energetic, to be energized throughout the day during Ramadan, can head to our Barokah booth.
Mm. So, okay, I think that concludes our session. Thank you so much, Lucas, for sharing all those very, nice tips that I can practice this coming Ramadan. Okay, and thank you everyone for your attention. So, I believe next is the Q&A session.
Yes.
Thank you.
Thank you very much, Mr. Lucas and Dr. Tina. And you're absolutely right, Dr. Tina. It is the Q&A session over right now. We've got a couple of questions. You can still keep the questions coming via Slido. Let's answer the question right at the top. Is 1000 mg vitamin C too high for daily usage? Who would like to answer that? Dr. Tina, perhaps?
Yes, I think I'll answer that. So, is 1000 milligram vitamin C too high? Well, a number of possible problems with large doses have actually been suggested, but all of those data are mostly lab data in vitros, because everyone has a different needs for vitamin C, right? And then with the current situation, there's a pollution, for example. Pollution will actually make our body needs vitamin C more. And 1000 milligram is actually still safe because like Lucas already suggested earlier, it is a water-soluble vitamin. So the body will recognize how much it really needs, and then afterwards it will just flush it out through your urine. So I think as long as it's still within 1000 milligram, it's still fine. Problems would come if we consume more than like 3000, which is a lot, like in a day. But 1000 milligram, it is still considered okay to be consumed, safe to be consumed.
All right. Next question. Are there any food recommendation to be avoided during Ramadan? Any food we should avoid? Lucas, this is your area of expertise.
Yeah. So hi everyone. Okay, so for food that recommended to be avoided during Ramadan is first is caffeinated drinks. Caffeinated drinks, for example, coffee and tea. Because during fasting, we only able to drink it during the morning time, our breakfast, and during buka puasa. So actually during the mid time, if the weather is hot and we are not drinking water, so it will keep us dehydrated. So I would recommend everyone to avoid drinking caffeinated drinks, because caffeinated drinks like coffee, tea, or soft drinks, it will flush out our excessive water from our body, and it will make us dehydrated. And
what if some people can't live without their coffee?
Okay, so if those who can't live with their coffee, I will recommend them, instead of 1 cup per day, maybe you try to have half cup. Because we are afraid you in the midday, you may crave for water or you will feel dehydrated, and there's a lot of dehydration symptom may come in. Besides caffeinated drinks, I also will advise you to cut down on sugary drinks or sugary food. especially those like, during Ramadan, they will sell like air bandung, air syrup, all these high sugary drinks, because too concentrated drinks, it will make us feel thirsty. And the lastly is salty food. Like ikan masin, all the cured food, I would advise them to avoid, because these three food, caffeinated drinks, sugary drinks, and salty food, they can cause us to have a dehydration problem. Yeah.
Okay, that is very, very relevant tips as well. And let's move on to the next question. When would be the best time to take a supplement such as Redoxon during Ramadan? Is it during sahur? Any preferred time?
Okay, I think the best time, I would actually recommend it during sahur, right? Because like sahur, we always have to take food very early in the morning, like 4 a.m. Now, taking Redoxon during that time would actually help us to feel a little bit more energized, right? A little bit awake. Now, it's okay to be taking Redoxon at other times, but I'm afraid that if we take it, say during buka puasa, right, and then we use Redoxon as a buka puasa, our stomach has been empty for like more than 10 hours, right? It might cause some discomfort for some people, because it's always very good to take supplements with food, right? And we hadn't really consumed any food for 10 hours. So so the recommended time would be during sahur, or maybe towards after the tarawih, the prayer at night, the 8 o'clock prayer. That those two are the recommended time during, but I actually prefer that people take it during sahur.
Okay. Thank you for the advice. Final question we have for Lucas. Is it true that you can get higher vitamins if you eat unripe fruits? I've honestly have not heard this before, but what do you think, Lucas?
Okay, so regarding the fruits, actually, regardless is it ripe or not ripe, actually the nutrients content is still the same. Just the difference is in sugar part. You can notice that if it's ripe fruits, it stays sweeter as compared to those unripe fruits. But if you talk about in terms of vitamins aspect, actually it's the same. As long as we don't soak it in the water, then the vitamins will wash it away, or don't cook the fruits. Because cooking and if in touch with water, these two preparation method will destroy the vitamins. But if it's ripe or not ripe, actually it won't affect much of the vitamin content of the fruits.
That's right. Pretty much just the taste and the texture, I believe,
Yes,
right?
exactly.
I'm thinking about durians right now because I see durians on the screen already. I believe in Thailand and in Malaysia, we consume durians differently. We wait until it's overripe and it drops on the ground. Whereas in Thailand, they would pluck it first before it's fully ripe, right?
Yeah.
Am I right?
Yes.
You're not a durian eater. Okay, never mind. Just my craving right now. Okay, and with that, thank you so much. I believe that is all the questions that we have. Once again, Mr. Lucas, Dr. Tina, thank you so much for imparting useful insights, loving the tips on diet and knowing that sometimes truly our current lifestyles do not fulfill the needs of our nutritional requirements. So supplementation is indeed very important to help keep us healthy and energized, especially during the Ramadan. For those of you who are watching and you will be fasting in a couple of weeks, we wish you a blessed Ramadan, including you, Dr. Tina. Yes. I hope you have a lovely Ramadan ahead in a couple of weeks. And I love all the tips about ulam and tempe. Mr. Lucas, you have successfully made us yearn for the Ramadan Bazaar, which I believe
Most
all
welcome.
of us are looking for.
My pleasure.
Have a great day ahead. All right, and with that, ladies and gentlemen, we have come to the end of our program today. We truly hope that you've gained some valuable insights for your practice. We value your feedback so we can strive to continuously serve you better. So do take a moment one last time, I guarantee, for you to whip out your phones and scan this QR code. I know I've been asking you to do that throughout today. This is the final QR code you need to scan, and that would lead you to a feedback survey via Slido. We would love to hear your thoughts. Just answer a few simple questions so that we can continuously serve you better. And once again, we would like to thank Sokfan for joining us here in the studio, and to all of our speakers as well for taking the time to share their thoughts and insights with us. And to all of you, most importantly, thank you for your kind participation here today. Do take this opportunity right now to visit the virtual plaza if you haven't already done so earlier on. That will be available throughout today and for the next 6 days as well. And your CPD points will be submitted manually. Just a gentle reminder, once again, the virtual plaza, we have a QR code over there if you'd like to take a memento of today's event. We've got a very nice virtual photo booth. If you scan the QR code, we also have a networking hall, and we also have our exhibition hall where you can find out more about our products from the 4 different booths available. So thank you very much for joining us here. Do stay safe. I hope to see you in real life soon, and have a great day ahead. Bye.